Do you remember your friends or family undergoing knee replacement surgery 10 years ago? They may have been complaining of pain and saying that they were unable to walk for a few days after surgery. I'm glad to say that knee replacement technology has progressed very much over the past 10 years. Knee replacement surgery involves shaving away the bits of bones and cartilage that's damaged and replacing them with a metal prosthesis with a plastic liner in between. Modern knee replacement surgery utilizes the enhanced recovery after surgery protocols, which allow patients to walk quickly on the same day after surgery with minimal pain. Very often, patients can also be discharged after 1 or 2 days. Patients who have had a knee replacement surgery done under the enhanced recovery protocol do so in a safe and comfortable manner, allowing them to walk quickly and resume their daily activities. A knee replacement surgery can be carried out in several ways. These include a conventional surgery, where your surgeon uses jigs to make precise cuts in your knees. This surgery can also be done using navigation with the aid of computers or using robotics techniques. These computer-aided and robotic techniques are generally more accurate and precise and may have a role in younger patients who are below the age of 65.